Okay, my name is Felix Moyongari, a speech therapist and also an occupational therapist at Lotus. Speech therapy is a medic professional who deals with generally speech habilitation and also rehabilitation. Firstly, we have those people or those clients who have difficulty in vocalizing. So we play a very good and a very big part in habilitation and also rehabilitation of speech. I will start with the pediatric conditions. For example, we have autism. Actually, when you come to autism, these are neurological. It is a condition that is mostly characterized with difficulty in communication. So, we as speech therapists, we work together with occupational therapists, where we have to be referred those clients with autistic spectrum disorder, and we help them to talk, communicate. Actually, speech is the basic to communication. Yeah, we have other conditions, for example, cerebral palsy. When we find children with cerebral palsy have difficulty in speech, and also kids or patients with Down syndrome. Sometimes we have others with Down syndrome will have a part of or maybe a percentage of communication of speech, but others will have difficulty in speech. Yeah. Others mostly we do rehabilitation because mostly of the cases you find that the clients had the ability of the functionality of speech, but now we find maybe an injury, maybe a condition or a disease happened and they are unable to speak. For example, stroke. For stroke patients, they have difficulty in speech. Why? Because when it affects, sometimes the parts of the brain affect the speech and also the motor part. When you come to the traumatic brain injury, for example, maybe it was a road traffic accident and maybe the brain was damaged or maybe it was affected. So you find that maybe a part or a structure of the brain was affected, and that's why the speech is normal. We have Parkinson's disease. We have many diseases, that affect speech. When we come to speech, to communication, we have verbal and non-verbal. For example, you can communicate through speech. You can communicate through signs or maybe gestures, and also you can communicate through writing. So when I say communication, mostly when I say communication and speech, they go hand in hand. For example, to adults, maybe a person, for example, had a road traffic accident, and maybe he or she lost the ability to see, so the sight is normal. So as a guardian or maybe a son or maybe a sibling, how will you communicate to that person? Mind you, he or she can hear. So trying to teach or educate on using the brass, so it is kind of difficult. But now you can talk to that person. For example, open your mouth, maybe during medication, or maybe eat, or maybe telling the client this is who is giving a visit. Sometimes people confuse between speech and communication, because speech is what we move from our vocals. And for example, I can communicate with you through gestures. You can say come. So that is easy, even without vocalizing, say come. Yeah. So people have to understand the benefits and the impact of speech in communication. Communication is the bigger part.